Hi, this is Chamonix. What constitutes good stuttering therapy? The longer I've been in this field, 22 years now, the more complex I realize stuttering is and its treatment. What is the best approach to therapy? Certainly, one size cannot fit all. Not only are no two people who stutter alike, no two clinicians are alike. Clinicians come from a unique background with their own life experiences and educational tools. My late mentor, Catherine Montgomery, said to me once, "The hardships of your life will make you a better therapist." She was right. We need to know when to use what tool. What a client is ready for and can handle may not be what we want for them. A foundation must be built. Sometimes they may choose to relate to and manage their stuttering in a way that varies from our philosophical beliefs about stuttering, and that's okay. Meet them there, support them. You have to be mature enough to hold space for their journey and be able to speak the truth when needed. Here are some real life examples of my clients that show one size does not fit all. First client is in his late 30s and was bullied severely as a child and reprimanded by a teacher repeatedly for stuttering. At age 14, he attended a 4-week fluency shaping program where he felt great relief and gratitude to be able to speak easier, and he's grateful for that program to this day. He went through life using these tools plus a variety of avoidance. He married and had kids. He begins to feel the impact of avoidance on his life and also begins to block when reading to his daughter at night. He stops participating in something he loves at work because it requires speaking. He sits down to search for stuttering help on Google and has a PTSD response and cannot finish the search. This continues to happen, and he needs his wife to do the searching, and we connect. During the consultation, I on purpose stutter with him to assess his sensitivity. He displays a trauma response over Zoom with rapid eye blinking, holding breath, a startle response, and rapid heart rate. Group therapy is not in his window of tolerance. He has zero interest in the stuttering community. He avoids anyone who stutters at all costs because their stuttering triggers his own trauma response. These are very good therapy options, but they're not appropriate for him at this time. He needs an accepting, kind person he can trust to share deep thoughts and beliefs he's buried for decades. One of his goals is to be able to tell his daughter that he stutters. I build trust. I do plan to teach him physical tools because he's asked for them. He also may end up not wanting them. Clients change in therapy. The physical tools are for control, and he wants some control right now. And who am I to force my philosophy on him? Plus, I can't. I can gently guide, plant seeds, and take opportunities when they arise, but I meet him right here in his pain. I hold space when he cries. My own journey taught me how to regulate my nervous system, which allows me to hold this safe container for my clients. I teach him how to implement a nervous system regulation tool while I incrementally use voluntary stuttering. This begins to reassociate stuttering with safety and sends the message to his mind and brain that he is okay. He works up to listening to a video from John Hendrickson I sent him about the listenometer. He reports back that for the first time, he understands why someone would choose to open stutter. It's starting, the change, and I'm excited to watch his growth. He says he's never told anyone about these things, how he reacts to his own stuttering, how he screams the words in the car on the ride home that he couldn't say at work. The art of therapy, when to listen and when to teach, when to lead and when to follow. Client 2 is 14 years old. He's super laid back, an awesome athlete, and has so much going for him. He has no trauma responses around his stuttering, so we don't address that. He's up for anything, so we dig into beliefs. We talk about identity and the stuttering community. He's up for meeting other clients and observes a teen adult group called Flourish. It's focused on open stuttering, reducing avoidance, regulation, self-advocacy, core beliefs, values, knowing self, enjoying communication, and living life. It's a lot of fun. He keeps doing his one-on-one sessions, and this group then asks for physical strategies one day, which was a little surprising to me. But since he can self-disclose with anyone, has great eye contact in all situations, uses minimal to no avoidance, and feels good, I agree. He wants to see what the control tools can do to ease out of some stutters. I explained that physical stuttering strategies don't eliminate stuttering, and they are intense work to wire into your brain. I explain how these tools can also be used to avoid, and what's most important is his intention behind their use, really for any skill or tool. I add him to a group that is focused on learning physical skills. I flow with his change over time. I plant seeds. I let him experiment and discover things for himself. Client 3 is a female in high school. She's basically not talking anymore. She nods her head no and yes to answer. Zoom sessions are interesting as she says almost nothing. She's been in therapy and school for 10 years. She hates the physical tools she's learned, and she got the message loud and clear that no one wants to hear her stutter. And since she can't use those tools, she doesn't speak. It would be unethical to work on physical tools with her. One size does not fit all. We very slowly build trust, unravel one part of her pattern of avoidance and protection at a time. I celebrate the big, fierce stuttering that comes out when she begins to talk again. She trusts me enough to share her thoughts and the part of her she has hidden. She leans into stuttering, internalizes the mindset to accept and allow, and she lets herself feel the free fall of a stuttering moment. She is building emotional resiliency. She is tasting freedom and finding herself. I celebrate it when she joins my Flourish group. The protector part of her subconscious mind is really big, but her adult self is growing. And as she begins to know herself and her values, she makes slow changes over time. Each client is different, and one size does not fit all. Thank you so much for listening.